If you're insured with one particular health insurance company, you may end up paying more when you visit Eastern Idaho Regional Medical Center. Our viewers alerted us to this issue, and we learned that Aetna Health Insurance ended its agreement with the Idaho Physicians Network, of which EIRMC is a member. Local News 8's Luke Jones breaks down what this means for customers.
It gets kind of complicated, so I brought us some flowcharts to help break it down. The Idaho Physicians Network is basically a network of physicians and hospitals. Instead of having every single hospital negotiate their own deals with insurance companies, the Physicians Network steps in and does it for them. By belonging to the network, hospitals agree to charge a fixed amount for services based on what the network is able to convince insurance companies to pay. Oftentimes, this results in discounts for people insured by certain insurance companies. But as of April 1st, we're told Aetna has ended its relationship with the Idaho Physicians Network. After this, most local hospitals were able to reach direct agreements with Aetna, but EIRMC was unable to.
When Aetna chose to pull out of Idaho Physicians Network, we offered them a direct contract with EIRMC, and that offer still stands on the table.
Now, Aetna says they declined that offer, and here's why. In a written statement, Aetna says, quote, when comparing services at other in-network facilities in the area, EIRMC is more expensive, end quote. EIRMC says any notion that their rates are more expensive than other hospitals is, quote, silly. It's important to point out folks with Aetna can still receive treatment at EIRMC, but they may end up paying higher deductibles because Aetna now considers EIRMC out of network. Okay. Here's what EIRMC suggests doing.
We would encourage those employees to talk to their HR folks and to encourage their company to consider other insurance carriers.
In turn, Aetna is telling its customers to avoid out-of-network hospitals. Now, we called the Idaho Physicians Network. We were interested in learning more about why Aetna may have pulled out, but they never got back to us. In the studio, I'm Luke Jones.